Our next speaker is Dr. Lynn Kirkwood. Dr. Kirkwood is a retired nurse educator who has had a long interest in the history of nursing education. She received her PhD from the University of Toronto in 1988 and taught nursing at Queen's School of Nursing for many years. Dr. Kirkwood is a founding member of the Canadian Association for the History of Nursing and of the Margaret Alumnae Society for the History of Nursing. She has published in the area of nursing history education, particularly university nursing education in Canada. She is a member of the Queen's Archives and Retirees Association Queen's Committee. This was news to me that this committee existed, which is the human history of Queens, collecting oral histories of retired Queen's staff and faculty. So I await my appointment. She is a member of the board of the Country Roads Community Health Centre in Portland, Ontario. And Dr. Kirkwood is also a member of the advisory committee on the Nursing Gallery program project, which we're celebrating this evening. The title of Dr. Kirkwood's talk this evening is Nursing Education in the Beginning, Keys to Success.
Just before I start, I would like to take this opportunity to both congratulate and to thank the Museum of Healthcare, Paul Robertson, Dr. Lowe, and staff for putting together and working so hard to put together this exhibit that represents, for many of us in the room, our past life. The development of nursing education in the 1870s and 80s was part of a larger international reform movement, of which hospital reform was part. It was a product of a complex set of circumstances in which doctors, administrators, and nurses perceived the benefits of transforming nurses' training. Florence Nightingale, because of her compassion and sanitary reform during the Crimean War, and her commitment to health care following the war, became the icon of modern nursing. The influence of Nightingale was rather mixed. She championed nursing as a respectable occupation for women at a time when women were attempting to play a greater role in public life. She perceived a holistic approach to patient care. To Nightingale, there was no distinction between the physical and the moral, the mind and the body. Nightingale believed this control of disease to be the role of female nurses, and thus nurses should be trained separately from medical students because medicine was too narrow a realm for women's skills. She insisted that nurses learn to objectively observe patients. Empirical observations were regarded as a necessary safeguard against the nurse substituting her own opinion for facts. The notion of holism and the idea of empirically gathered patient data still play a significant role in nursing today. While Nightingale laid down the focus of nurses' knowledge base, her ideas about how nurses should be educated were unfortunately not followed through. Nightingale's aim was to establish an independent training school at St. Thomas's Hospital where nursing instructors had full authority to train nurses for hospital and district nursing. In Canada, as in other countries, this did not happen. There was no separate fund in hospitals so that the training programs could remain separate from hospital control. Thus, training schools were driven by economic concerns rather than epistemological ones. Nurses' training provided the hospital with a disciplined, dependable, and cheap workforce. Nursing superintendents walked a thin line between the demands of service and the education of students. These service for training programs were well received. KGH, established in 1886, was one of the first cohort of 70 training schools by 1902. There was much interest among women in these programs, and early nursing programs never suffered from lack of applicants. At KGH, there were 15 applications for the 2 positions offered. The reason women gave for going into nursing were many and varied. And each of us probably has a story. The new schools offered nurses skills, respectability, financial security, challenges, and adventure. According to Kate McPherson, although conditions in hospital were harsh, nursing offered a safe passage out of rural and small town Canada. Nursing provided cheap lodging, a small stipend, and good food. One student recounts that during the Depression, she was the only one in her family working. We in training were lucky, she said. We worked hard and studied hard, but the sisters fed us well. Also, parents appreciated the strict discipline of residence life and were much relieved when young women from the rural areas in the small town came to the city to know that they would be so well disciplined and cared for. Over the years, programs did become more student-friendly. Observing the total patient was the watchword of training. And we can all remember, I'm sure, the instructor, or heaven forbid, the head nurse, who came up and asked us to give a report on a particular patient, and then started questioning us on what we had left out, what we could see, and what we weren't seeing. The womanly qualities were a reality of residence life. In the larger hospitals, instructors were hired as time went on, and the superintendent position was often divided into 2, into the Director of Nursing Service and the Director of Nursing Education. Gradually, as patient acuity increased, first-year students spent more time in the classroom, and third-year students spent more time on the wards as interns, thus providing more effective care. And the outcome of these programs was very often decided on some type of research to determine how nurses should best be trained. The hospital training programs continued uncontested until the 1960s. At that time, because of government funding, which was directed towards patient services, hospital administrators were hesitant to direct that money towards education. Young women and men of the 60 generation resented the strict discipline of residence life. With the establishment of community college, training schools were transferred to the new institutions. 100 years after the establishment of the first nursing programs, nurses gained control of education. In the 1920s, George Weir, a professor of education at UBC, was given sweeping powers to study all aspects of nursing education. In his report, he warned that sooner or later the university, along with the well-equipped hospital, would be called upon to educate nurses, since university education was an essential part of professional progress. Although most reluctantly, 5 universities in 1919-1920 accepted these early programs, not because nursing was seen as an entity in itself, but because of nurses' value in social reform. Scientific management was part of hospital structure, and public health was part of the social reform movements after the First World War. According to the Rockefeller Foundation, documents which funded the Rockefeller Foundation, which funded the early program at the School of Nursing, U of T, suggested that never at any time was it anticipated that the officers of the foundation could or would do for nursing what it was to do for medical education. Nursing was not considered to be a name in itself. Nursing was purely ancillary service. It has been suggested that this move to the university, nurses merely traded the control of hospitals for that of the university. Excuse me. Well, I would suggest that this might have been the case in the case of U of T, because although Kathleen Russell, the director, did all the legwork for that funding and was highly regarded by the Rockefeller Foundation, it was the Dean of Medicine and the President of U of T who signed the contract. Others, however, disagreed. Elizabeth Logan at McGill said that we could teach nursing in Greek for all they cared. As long as there were enough tried and true university courses in the curriculum, they didn't care what we did. Under the leadership of Elizabeth Logan and Moira Allen, they used their time profitably. And the faculty developed one of the best models of nursing practice, one that is used in many nursing schools today, and in fact, I believe that a similar type of model is used in one of the family practice units in this area. Russell herself was no shrinking violet, and if she wanted to experiment with courses, she just told the university officials and Rockefeller that she was merely rearranging courses to suit a small number of students. That way, she developed a first a diploma program, and then one of the first integrated university programs. Today, we all know that diploma programs are a thing of the past. The notion of nursing as having a separate intellectual body of knowledge is generally accepted. Degree programs are standard entry to practice, and master's and doctoral programs are training research, educators, and practitioners. We owe the early nursing reformers of these hospital programs a debt of gratitude for laying a solid foundation of the meaning of Florence Nightingale's ideas of compassion, holism, and scientific inquiry. However, there can be no final conception of the right way to educate students. It must be, as all professional education, evolutionary.